the physical trauma, and you see all of the psychological changes on the face of this child. This is the meaningful pictures of the child abuse. My name is Dr.Dilman, MSc in the Forensic Medicine, Holland Medical University College of Medicine, and this is the 12 years experience in the Forensic Department in the Algeria. About the child abuse, we all know the definitions of the child abuse, which is the any interaction or lack of the interaction between the family members and caretakers, which results in the non-accidental harm to the child's physical or developmental states. Also termed child battering, non-accidental trauma, and shaking baby syndrome. لو أنا نزلنا shaking baby syndrome سياعة كاتك كمضالي أو هذا زليني أو كان shaking baby syndrome. Types and the classification, we have different types of the abuse. We have the physical abuse. As a forensic pathologist, we deal with the physical abuse and the sexual abuse more than the other abuse. Blows or strike, pull or twist, strangulation, burn or scalp, forced restraint, drowning, hair pulling, forced ingestion. All of these types of the physical abuse. Another type, which the worst type, is a sexual abuse. Unfortunately, in our community, we have too much cases about the sexual abuse in the children. We have inappropriate exposure. We have inappropriate touching. We have sexual intercourse. And we have sodomy, object insertion, and surgical operation. All of these terms belong to the sexual abuse. But the sexual abuse تنها أو نادي دستيداني خراب يشتغل هوا لبو من دارا دستيداني كي بسيط بوي دوري من دارا كان فير كان ككز دستيان نكاتي دشتين هستيا. Physical neglect, we have uncleanness, malnutrition, growth disturbance, susceptibility to infection, hyper or hypothermia, accidental injury or ingestion by the child. We have emotional abuse. طبعاً our emotional abuse as a forensic we are not dealing with it. Only we must discuss it because it's a type of the abuse. Anxiety, depression, cause anxiety, depression, suicide, nightmare, sleep disturbance, headache, other non-specific physical complaint, regression to earlier developmental level, drug alcohol abuse, refusal to speak, inadequacy in education. Okay, ثاني عندك ذاك دينا forensic department كهرزكارو مستيكي دوري كرديا همو هستريا كان child abuse كذا لأنه هذا البارت كان لايف يان child abuse يعني خطوة كتوشي أو مستيكي كرديا. Scope of the problem. We have prominent problem in all countries and cultures. Increasing incidence of the versus increasing recognition in the last 20 years. These are the epidemiology in the USA. Million physical abuse cases, which is too much. 3,000 day, 300,000 sexual abuse cases, 250,000 psychological abuse cases. Parental factor correlated with the economy, divorce, drug alcohol abuser, arrest for the violence, crowded household, low self-esteem, young self-abused child, emotionally immature, depression, poor impulse, and unrealistic and result of the job of the family. Most of the cases related to the psychological trauma. The parental psychology of the parent. Children prone to being abused. طبعا أنا زور دبينين forensic department. لو أنا خلق بين أنا كما بس أما بزوري بيان بيني زورن يعرفونيش diagnostic. Hamana under 6 years old, physically or mentally handicapped, twin, unwanted pregnancy, chronic or recurrently ill, is more prone to be sexual or physical abuse or emotional abuse. Features of the medical history which may indicate a child abuse. There's some history that indicate child abuse. History not goes down with the severity or type of the injury. Children development level. Delay between the time of the injury and the presentations. History of multiple or recurrent prior injury. Different history of the injury from the caretakers than from the child. Caretakers react inappropriately to the situation, under or overreaction. And we have the